welcome to our special show. Two COVID waves have helped bring health as the primary focus area for most people. It's important for society to learn the right lessons so that we can take steps to prevent or be better prepared for future COVID waves. The COVID pandemic had a big impact on health systems around the world. While dealing with COVID, we overlooked the fact that people's lifestyles were severely disrupted, and as a result, metabolic problems have become more common. It's also important for people with diabetes and heart disease to understand how to better manage their conditions at home. Learning how to control your diabetes, heart disease will save money and time and help you have fewer emergencies and hospital visits. Today we have with us experts to share with you advice on diabetes and its management. We're joined by Dr. Vaibhav Dukle, MD Medicine, DNB Endocrinology, Consultant Endocrinologist, Dr. Dukle's Hospital and Research Center, Goa, Dr. S.D. Joshi, MD Medicine, Consultant Physician, Dehradun, and Dr. S. Balaji, MRCP, FICC, Senior Consultant Cardiologist, Sri Ramakrishna Hospital, Coimbatore. Thank you so much, doctors, for joining us on this very, very important program. I'd like to start with you, Dr. Vaibhav. Are people with diabetes at a higher risk of developing serious complications from COVID, and what are those complications?
People with diabetes, they are not more prone to develop COVID-19. But however, if they develop COVID-19, they have more severe form of this disease. This is because of three things. One is they have a less robust immunity. Second, diabetes like COVID-19 is a pro-inflammatory and pro-coagulant state. And thirdly, these patients, they have very mild symptoms. It may be just like uncontrolled blood sugar, fatigue, loss of taste, smell. Classical symptoms like fever may be absent. So the disease is diagnosed later or at an advanced stage. This leads to more complications. This may be in terms of increased need for hospital admission, increased need for ICU admission, increased morbidity, increased mortality, and also a lot of other infections may develop during hospital stay. A very important fact is that post-COVID-19 recovery also, sugar control is very important because a lot of opportunistic infections, principally what we know is tuberculosis, mucormycosis, other fungal infections, other bacterial pneumonias, they also can occur if the sugar control is not good in the post-COVID phase.
Dr. S.D. Joshi, if you could tell us what are the symptoms and warning signs that one should be watching out for?
You see, diabetes nowadays, already it was in a big light, but after COVID, a lot of those people who were remain admitted or who has taken wrongly or rightly the steroids with him, he had more diabetic symptoms, earlierly controlled on the all drugs, then he again started having the symptoms of diabetes. Just I will enumerate them shortly, that if the patient starts having more thirst, passing more urine, having recurrent infections like boils all over body or any infection it does not heal rapidly, and patient is having weight gain in those time after taking lot of meals. Sometimes those patients who are previously also diabetic, they had the more symptoms of burning sensation in all over body and letharginess, always having lost the energy or not doing his routine work properly.
All right, Dr. Balaji, now is it possible for a person with past COVID history to develop cardiac disease, and what are the possible reasons, and of course how can we prevent them?
Certainly yes. Somebody who's had COVID has a significant chance of developing heart disease even up to few weeks or few months after the initial COVID infection. So the reasons for this are, one is people with COVID have a high chance of developing blood clots, and also they have inflammation in the blood vessels. So this causes a chance of clotting in the blood vessel and heart attacks developing. The other thing is the stress of COVID itself and the oxygen levels being low. This can also cause heart attacks in some patients. Now, how can we prevent them? See, we identify patients who have had COVID and check their set blood tests. And if the clotting levels, the D-dimer, or if the inflammatory markers are high, then we give these patients blood thinners for a few weeks to 3 months, and this can reduce the chances of getting blood clots.
All right. Dr. Vaibhav, now as we already know, type 1 and type 2 diabetes are very different. Their treatment protocols are also different. Are the risks of developing diabetes-related complications different for people with type 1 and type 2 diabetes?
So type 1 diabetes is mainly insulin dependent, while type 2 diabetes is mainly insulin resistant. However, the unifying factor in both these forms of diabetes is hyperglycemia or high blood sugar. And in fact, most of the studies in type 1 diabetes, they have shown that patients who had higher HbA1c, that is the 3-month average sugar, had more complications when they had COVID-19. So most of the complications in these two forms of diabetes are similar. However, one unique complication which is also seen in type 2 diabetes but more commonly seen in patients with type 1 diabetes is called as diabetic ketoacidosis. And this is a very life-threatening condition due to buildup of ketones and acids in the body. So diabetes control needs to be very strict irrespective of the type of diabetes.
All right, Dr. Joshi, now how does self-monitoring of glucose help both type 1 and type 2 diabetes patients?
See, this is nowadays concern is that CGM, continuous glucose monitoring. So this can be done by two methods. Either the person who is a diabetic, he should have with him the glucometer, and he should take the one sample before taking meals and another after 2 hours after the meals. And continuous glucose monitoring is another which is done by the implanting some little machine in the body, and this machine will take the continuous serial readings of the blood sugar, and after 24 hours or after 36 hours or after 48 hours you can keep it with you, and you should record the blood sugar in a proper manner. And whenever you go to your treating physician or diabetologist, you should take that reading with you. We say that nowadays regular monitoring is there, and another is HbA1c. HbA1c is the 3 months monitoring of the 3 months blood sugar. And if the fluctuation is much more there, it's after lunch it goes beyond 200, then after dinner again it is high, then you should immediately consult your treating diabetologist or physician who is your doctor, and you should monitor it accordingly.
All right, and Dr. Balaji, if you could explain to us the difference between a cardiac arrest and a heart attack. People often, get confused between the two. So if you could tell us the difference.
Sure, that's a very interesting question, because heart attack happens when the blood supply to the heart muscle stops. See, there are 3 blood vessels in the heart. When a clot develops and blocks off one of the blood vessels, that portion of the muscle does not get blood supply, so a heart attack happens. So the treatment would be to restore the blood supply. Whereas in a cardiac arrest, the heart stops functioning. The heart is not contracting anymore. It's not supplying blood to the brain and other parts of the body. So cardiac arrest has to be attended to immediately. Even a delay of 3-4 minutes will cause brain death, and the patient cannot be resuscitated. So a cardiac arrest is a situation where the heart has stopped functioning, whereas a heart attack, the heart is still functioning, but one of the blood vessels is blocked, and the situation can be addressed and rectified.
All right, so important to know that difference. Dr. Joshi, now during the pandemic, another issue that arose was that people were not going for their regular follow-ups for their chronic conditions. Diabetes patients especially, those on insulin can need a medication dose adjustment. So what would your suggestions be for such patients?
Yeah, because there was much in the media and in social media also that the patients with diabetes should not go out from their home because they are more susceptible for the corona infection or COVID infection. That's the main reason why these people, they didn't went to their doctors and their diabetologists. So my suggestion is they should do either online consultation with their treating physicians or treating diabetologists, and whenever there is any change in their daily routine, or there is change in the blood sugar levels which they are monitoring regularly, then they should consult, or they should also consult the with diabetology, this nutrition experts also, to change the how they are taking during COVID, because they were not going outside for a walk, or they are not going to gym, or they are not doing much of the exercises. They were usually doing morely yoga and meditation at their home. But for a diabetic, along with yoga, there should be some more physical activity to reduce the blood sugar levels and to control the diabetes.
All right, so very important to keep all that in mind. Well, we'll slip into a short break and return to this special program where we're discussing COVID, health and diabetes. Welcome back to our special program on health in the times of COVID, and we're talking about diabetes management. Let's go across now to our panel of doctors. And Dr. Balaji, I'd like to start with you. How can one effectively manage hypertension and reduce the risk of a heart attack?
See, hypertension today is a very common problem. See, it's very, very prevalent in the society, and we now have younger and younger patients presenting with hypertension. See, the most important thing is education of the patient, because it's very important for them to know that controlling blood pressure is important, because this can affect the heart, this can affect the kidneys, eyes and brain. So it's very important to stress the need to follow lifestyle measures, reduce the salt intake and to take medications regularly when required. The problem is, see, hypertension can only be controlled. Most of the time it cannot be cured. So it's very important for the patient to understand that he has to take his medicine regularly. He cannot take it for 5 days or 10 days like a fever or stomach pain and stop the medicine. It's very important to continue the medicine and have the blood pressure checked periodically. Of course, if the lifestyle change happens, then some patients may come off medication, but this should be done with the consultation with the treating physician.
All right, so that's again very important to keep in mind if you are suffering from hypertension. Dr. Vaibhav, what are the factors that a person with diabetes consider before using a home-use blood glucose monitor for self-testing? Are their readings accurate? Which type of kits should one be using?
Home monitoring of blood glucose via a glucose monitoring device, which is called a glucometer, is very important, especially in these times of pandemic where stay home, stay safe is the norm. The diabetic patients, they need to know where they stand. There are 4 important parts of diabetes management: diet, exercise, medicines and monitoring. So for monitoring, the standard of care across the world is now home monitoring. So whenever a glucometer is being chosen, there are 4 important things to be assessed. And the most important thing is accuracy, because we need to rely on these readings. So there are ISO standards, and if your glucometer meets ISO standards, then it says that at least 20% of the readings above 75 milligram per deciliter will fall in that range within a specific target. The other issues are simplicity. If it's a technically advanced machine and you're not able to do it, there's no point of such a machine. Third is cost, because it needs to be affordable. You need to be, there's a constant cost of buying the strips. And last is availability of the strips. So these all 4 things need to be kept in mind whenever we get a glucometer, the foremost being accuracy.
All right. Dr. Balaji, how does heart disease affect women differently from men? Are symptoms of heart attack different from men and women?
See, about 20 years back, it was not common for women to develop heart attacks. But now the incidence is increasing, sometimes even as much as men. See, before menopause, women are protected from heart attack to some extent because of the estrogen in their hormonal system. But after menopause, the risk of a heart attack is the same for both men and women. In women, heart attacks tend to happen a little later, on an average about 10 years later than men. Sometimes the typical symptom of chest pain may be a little less in women. They sometimes present more with breathlessness, back pain, and this kind of symptoms. So diagnosis can be a little late in women, and therefore the time delay can be more before diagnosing a heart attack in women. But nowadays it's very important to remember that because of stress and equality, the incidence of heart attacks is almost similar post-menopause in both men and women, And it's important to identify the risks and treat these in women also, like we do in the male population.
And also, doctor, a change in mindset. People need to realize that women are also prone to heart attacks. That's also something that we need to create more awareness about.
Yes, definitely, because as I said, it's very common now for women also to get heart attacks. So we cannot ignore the subset of the population. We have to make it aware to the population that women are also at risk of heart attacks, especially after menopause. And it's very important to treat the risk factors in women also, like we do in men.
All right. Dr. Joshi, what steps can women take to better manage gestational diabetes?
See, the method how the diabetes develops in men or women, they are the same. The main culprit behind the diabetes is the insulin shortage in the body. Either insulin is short or the utilization of insulin is not proper by the body cells, or the insulin is resistance is there, so that the diabetes is not controlled. In women, usually they are doing all type, either they may be homemakers or they are working ladies. The homemakers, they do routine work from early morning 6 to late night 11. So they are performing the home deeds all the time. They are not taking care of the exercises, etc. They just say, Doctor Sahab, hum to din bhar kaam mein hi lage rehte hain. But that is not the proper. They should do the proper yoga and at least take 30 minutes per day for the exercises, that aerobic exercises and the yoga also. The onset and the mechanism is the same in the male and female, but the thing is there that the obesity, if it is obesity is one of the main cause for the diabetes, which is more among the females than in the males. Otherwise, there is no difference between the male and female getting diabetes.
All right, an important point there for women to take care of themselves and take some time out for some physical exercise. Doctor, that's a very good advice, and more women should, hear that. A related question, Dr. Vaibhav, is a woman with gestational diabetes at increased risk of future diabetes?
Gestational diabetes is diabetes that is first recognized in pregnancy. And as soon as the delivery occurs, almost always the sugar returns to normal almost immediately. However, this should not be a sign that the story is over, and this is a warning sign that in future life type 2 diabetes may develop. This is because during pregnancy the body could not overcome the insulin resistance, and this is similar to what occurs in type 2 diabetes. In fact, almost 50 to 60% of women with gestational diabetes go on to develop type 2 diabetes in later life. This risk, however, it can be mitigated or lessened by intensive lifestyle modifications, principally being losing the pregnancy associated weight, good diet, good exercise throughout their life post-delivery.
All right, well, thank you so much, doctors, for sparing your time and joining us on this very special program, very important program. And really, if this pandemic has taught us anything, it is to focus on our health and immunity and to watch out for any sort of signs. Thank you so much again for joining us. Thank you for watching. Goodbye.